morning, guys. Derica asked me for some education for you. We decided a video might be a cool option for you to be able to go back to see, but basically how whenever you mix your pediatric medications, how to load them into your Alaris pump if you're using a syringe pump versus a regular one. And so I wanted to go over that. First things first, when you turn your pump on, if it's a pediatric patient, make sure we are selecting Peds Critical Care. ER is always critical care, whether it's a pediatric patient or an adult. Even if they're not considered critical care, we're still going to select that because that's what our guardrails align to. So when you turn it on, it's a new patient, and we're going to say no to critical care, and then we're going to go down to Peds Critical Care, and we're going to select that option. Okay. And so in your med room, you do have the list of pediatric medications for reconstitution. Since you guys are specialty and you don't have pharmacy on site, it gives you the directives of how to mix that. Well, some of those mixings are in syringes. So whatever size syringe is appropriate for your reconstitution is what you will need to grab. And the cool thing about the Alaris is that it's a smart functionality, so it'll pick up on whatever size syringe you have in there and how much fluids are in there. So on top of your meds that you have, you're going to need a flush, and you're going to need your syringe tubing, because in Peds world, we don't use our meds to flush the tube. We actually flush the tubing with normal saline first and then apply our medicine to the end of that, because it could affect how the Alaris is reading what your med mixture should be, because everything's based on guardrails. All right. So what you're going to do is you're going to take your tubing out. You're going to take your flush out, and it only takes about 1.5 cc's to fill up your tubing entirely. And you're going to flush your line. All right, so we're all flushed, and now we can attach our medications, and we're ready to put it in our Alaris. So let's just use for education purposes today that this would be a cyclovir, okay? So how you do your thing is your plunger goes up here and it clamps in here, but there's this little piece where the neck slides in between, and that is what holds it in place. So right here you'll see this portion, it slides right directly in there to hold it in. This pulls out and twists and also holds it in, and then you're going to turn the gray portion so that claw opens, and you're going to go down and clip it around the end of your plunger. And so now you're ready to scrub your hub and connect to your patient. But what we're going to do is we're going to channel select. See how it automatically anticipates the size of this. So this is a 50 cc, and you can just select BD plastic pack 50-60 mLs. Confirm, and then now it'll bring you to your med screen. So let's go to drugs. Let's look up a cyclovir, and just for today's learning purposes, we'll do non-weight based dosing. So 500 and 100 was selected. This obviously doesn't compute because I just pulled up some sink water just to show you the functionality, but we will say yes. And next, and then it's going to give you on how quickly we should infuse it, and then you're just going to go ahead and start it. So because again this is not computing due to the fact that I just picked a random drug, we'll say yes, that's fine to go because it's below guardrails. We would never want to go over guardrails, but then it's going to go ahead and infuse your medications over the allotted time. And as your plunger gets probably close to about a quarter of the way until it's finished, it's going to start alarming on you, like syringe is almost empty, syringe is almost empty. And then what you can do to finish getting all your medicine out of here, you could actually just grab a flush when your meds are totally infused, but there's still some in here, and you could put your 10 cc and do a back flush behind it if your patient is big enough to support a full 10 cc's. Now if it's neonatal, you could just do like 3 mLs of it, or you could do like 2 mLs, because we know it only takes about 1.5 cc's to fill this. It's very a small amount, so just whatever fits best for your patient. If you guys have any questions or concerns about how to set up the syringe pumps after this, please feel free to reach out to me or Derica, and I can help facilitate some hands-on learning.